Primal Bones is rooted in the belief that the body heals itself when given the right signals, not just metaphorically, but literally. Through tools like osteogenic loading, primal movement, and environmental alignment, we activate the body's natural ability to regenerate at the deepest level, the skeleton. This podcast explores how to create a healing ecosystem inside and out so the body doesn't just survive, it rebuilds, grows stronger, and remembers what it's made of. From bone density to nervous system resilience, from gut health to sunlight, Primal Bones is about relearning the physical and philosophical foundations of thriving. Okay, well, welcome to the Primal Bones podcast. I'm Jane Heaven. I'm here today with Paige Genova. She is the owner of Vital Pelvic Health. I'm going to let her give you a little short, brief bio of her, but I am so excited because I think Paige is one of the movement changers for women in this area, and she's making a big impact on women's health. So I'm so excited to have her on our podcast.
Thank you. I'm happy to be here. And, I hope that was the goal, from the get-go, is to bring world-class healthcare to the Youngstown area, because I feel like historically Cleveland, Pittsburgh's more known for their healthcare, and I feel like we kind of got left out here. Like, if we want really good healthcare, we'll drive to Cleveland or we'll drive to Pittsburgh, and that shouldn't be the case. We deserve really, really great care here. So from the beginning, my goal has been to elevate healthcare in our area, like set a different standard for like what should be expected when you call a clinic, when you walk into an office, the type of care, the type of, one-on-one, individualized, like we actually care about you. You're not just a number type of healthcare, but then definitely within pelvic healthcare, like really elevating what we do in this area, and even, within the United States, like to make an impact.
I was intrigued from the very moment when you said why you chose this area, or why you chose Vital Public Health, and why you chose the method that you have of bringing that type of care. Can you kind of tell us a little bit about that?
Well, I was born and raised in the Youngstown area. I grew up in Columbiana, so I really believe that our community deserves good things and good care. I just was hearing a lot of people talking about going up to Cleveland for different, medical care. And when I heard about pelvic floor therapy, I'd been working in like ICU critical care for 5 years. And then I met a pelvic floor therapist who was at the Cleveland Clinic. And instantly I was just like, this is the most interesting thing I've ever heard of. Why don't I know about this? Why aren't more people aware of what you're doing? This is huge. This is such an underserved population. It's niche in a way, but it just was so the impact she was making, and how I loved serving kind of underserved, more challenging patient populations. And I've never been somebody who was like afraid of talking TMI, and that I was always that friend, so I was like, this will be perfect for me. And as an OT, we were already in that realm of like toileting, bowel, bladder function, your everyday activities, sexual function. So it was just a really great fit. My undergrad was in psychology, and it just was like a divine intervention. I knew right at that moment that was something I wanted to pursue. And I just knew that at the time. And it took me years doing pelvic floor therapy in more of the traditional healthcare settings in the hospital, and like the outpatient kind of like ortho-mill population, to realize that to do pelvic healthcare is very different than like, seeing somebody for a knee replacement or a rotator cuff or an ankle sprain. It deserved a different type of attention, expertise, a different setting. And so I just didn't know anything about business. So some days I feel like I don't know anything and I'm not qualified for this. But I knew that if it was going to be done right, I had to just do it on my own. And so that's when I decided to start my clinic. And so we'll be on year 4 now that I'll have had the clinic, which is exciting and crazy, and it goes so fast. But I have a team of 2 other therapists. I have my admin, and we're just, more and more people are finding us every day, and we're just making such an impact. Like, my therapists are just I'm just so grateful because what we do is so rewarding, and the things we can help our patients with, and people drive from hours away to come to us, and it's just like the impact we can make is massive because pelvic health care, bowel, bladder, sexual function, pelvic pain, pain in and around the pelvis is so incredibly mistreated in our current medical system that it's life-changing for these people.
Well, and it's a topic that is very difficult for most people to talk about, even to their girlfriends or to their husbands or husbands to wives, whichever direction it goes. It's a very difficult topic, and even talking to a doctor about it. What if a woman goes in and says, "Hey, I'm having issues with my bladder," like with leakage. It's kind of difficult for in a 15-minute patient doctor interaction
for sure
to really get to the root of that.
And I mean, we hear from a lot of patients, and I work with people virtually all over the world, and so I hear a lot of different stories, and it is a product of really the insurance companies that are making doctors have such watered down care where they can only see you for, on average, it's 7 minutes before they really got to get moving, or else they're not making any money off of that from what insurance is giving them. I do believe doctors want to do the right thing, and they become a doctor. They don't go through all of that because they don't care about people and they don't want to help. But the system is just really not set up for good quality care. And so you are, paying that copay, and you're kind of getting that copay service. And that's the unfortunate truth of it. And so when it comes to things like, and we treat men as well, and it's a women's health issue, but it's also men's health issue too. They are not getting properly treated. They're not getting the right conversations as well. But I think that the doctors don't have enough time. They are not educated on pelvic floor, pelvic health at all in medical school. Even the OBGYNs, they do not get that education in their medical training. If they do know anything about pelvic health or the pelvic floor and its role that it plays in bowel or bladder function or anything like that, it's because they've taken their own initiative to learn something on their own. But doctors are not learning this stuff. And so even the people you would think know a lot about it, urologists, OBGYNs, urogynecologists, they still don't know. And it, again, because it's not, they don't have time to really get to the root of it in those short sessions.
Right.
And so much of what pelvic health encompasses is the musculoskeletal system and the nervous system, which they're not experts in.
No.
And so, I think we have to get used to, as a society, not just looking to the doctors for everything. Now, obviously, we want to make sure you don't have anything medically red flag going on and getting proper testing and all of that stuff. But when it comes to a pelvic floor issue, they aren't going to be able to help you. They'll only be able to offer you medication or surgery, both which are extremely unnecessary for the pelvic health concerns or any pelvic floor therapy concerns. And if they are something that need to be done down the road, we can always go there. But what other part of our body do we just skip conservative management and jump right into invasive treatments or unnecessary medication? So that's all they know. And so that's all they're going to be able to offer you. Now, I just wish that they would maybe get more comfortable with saying, you know what? Leaking isn't normal. You don't have, even though it's common, it doesn't mean it has to be acceptable.
Right.
And that's not my expertise, but this is people who can help you. They're still the hero if they send them to us and we can help them. We're the experts in the musculoskeletal system and their nervous system. They're not. That's okay. I would much rather them just say, I'm not an expert in this, but that is something that I know these people can help you with. It's not normal. You're right to think that this is, affecting your quality of life. This is how you get better. That's all they got to do. And instead of trying to be like, oh, just do these Kegels, or, oh, that's normal, you've had a baby. It's like, just don't say anything. It's just, you know what I mean? If you don't, I'm not going to speak on medication. I'm not going to talk to you about, dosage of your whatever medication, because that's not my training and that's not my expertise. I would always say, you need to talk to your doctor about that because that is their expertise. I wouldn't be like, well, I think that, one time I heard that this at a conference and you could probably do that, or, well, nah, you don't really need it. It's like, it's not their expertise. I wish they would just stop normalizing it, start listening to people, and then just refer.
Yeah.
Stay in your lane
Right.
of expertise. And you're never going to be able to solve these complex issues in these visits with the doctors unless they're just offering surgery or medication, which again, for 99.99% of the people we see are absolutely not necessary.
So I know you have your prop there, your
Yes.
little pelvis. So let's
Yes.
talk about it. Show us, like, what is the pelvic floor?
So the pelvic floor is everything in red. So everything that you see in red, and this is all musculature.
That looks like muscle.
Yep, it's all muscle.
All muscle.
There's ligaments in there. There's some fascial connections as well, but for the most part, it's a muscle group, and so it works in conjunction. Kind of the old antiquated aspect of pelvic floor was you can strengthen these muscles. You can isolate them, find them, and strengthen them, and that's all you got to do. Just do some Kegels, and that is so far off from what is necessary. Kegels largely don't do anything. They can actually cause more problems than they do good. And the pelvic floor doesn't work by itself. So we now know, after, years of evolution and therapy and research, the pelvic floor works with the rest of the body.
So it works with the skeleton.
It works with the skeleton. It works with your spine. It works with your hips. It works with your diaphragm, your rib cage. It is very intricately woven into that whole kind of core canister, but also down all, it connects to the hip, so down all the way to the foot. So sometimes we're treating the foot when we're treating pelvic floor issues.
Is that right?
Yeah, so it really is dynamic. It's dynamic. So that's why
Wow.
that kind of idea of just like, let's just find these muscles and tighten them is so unhelpful, because it doesn't work by itself. It's kind of like a trampoline that is supposed to be springy and adjust and be able to absorb pressure and move really dynamically with the rest of the body. And so all on its own, mostly involuntary. So why would we ask it to do something voluntarily over and over and over again when that's not how it works functionally? So it works with the body, with the surrounding tissue, with the skeletal system, with your organs. So it helps control all the sphincters. So rectum, vaginal canal, urethral, that is all the pelvic floor. So to get in or out of the pelvis, you have to pass through the pelvic floor. So it's kind of like a gatekeeper, which is why the pelvic floor can have such a big impact on bowel conditions, bladder issues, leaking, difficulty emptying, constipation, pain with intercourse, pain with insertion, because it is that gatekeeper of things going in and out and those sphincter control. It also is a sub pump for the lymphatic system, which really gets like undervalued for the pelvic floor. So all those lymph nodes inside the pelvic floor contracting and relaxing throughout the day, kind of moving dynamically, helps to pump that lymphatic system and flush toxins out. So it's really important.
That sure is. So that's a female
Yeah, this is a
pelvic
female
floor.
pelvic floor, but the male pelvic floor is largely the same, outside of one opening, and then the diameter of the pelvis is a little bit wider. But the male pelvic floor is the same. The urethra is obviously longer. There's not a vaginal opening, but outside of that, it's pretty similar, and they suffer a lot of the same pelvic floor issues that women do. So, I think a lot of men don't even know they have a pelvic floor.
Yeah, well, right. Is it true? I have heard that sometimes lower back pain can be a symptom of pelvic floor dysfunction.
Yeah, so there was a study that they looked at women with low back pain, and 98% of them had pelvic floor dysfunction. And so the pelvic floor attaches, and this might be a better view here, attaches right up to the tailbone and then up into the sacrum. So it is a part of the low back.
Okay.
And so if the muscles of the pelvic floor have tension in them, so they're too tight, that's going to affect then that sacrum and the tailbone. It's going to pull that, kind of like a tucking mechanism. It can cause back pain, tailbone pain, hip pain, SI joint pain, and affect that kind of lumbar curvature that you have, because muscles are what move bones. And so if you're having, especially if it's like chronic or persistent back pain that doesn't really respond, or you feel like you're always going back to the chiropractor and always having to stretch it out, it blows my mind that when we're looking at low back pain and hip pain too, that we're not looking at the giant muscle group that directly attaches to those
Wow.
structures,
That's
because
huge.
it's often the missing piece for those patients. Yeah.
Wow. I mean, that's a remarkable. So,
Yeah.
because I read on some of the reviews for that you have from your patients,
Yeah.
that some of them have said that they got relief from so many issues
Yeah.
that they didn't know they could get relief from
Yeah.
just having pelvic floor training, pelvic
Yeah.
floor
Yeah. Rehab.
rehab,
Yeah.
right?
So I think people, the general, if they do know what pelvic floor therapy is, there's still a lot of our patients, and it is evolving. It's not like it was, 8 years ago, but a lot of people really do just think that their pelvic floor is weak and that they need us because they're leaking. And then they come in and we're like, no, your pelvic floor is not weak at all. It's actually too restricted or has poor coordination, and also is contributing to your constipation and difficulty emptying and your hip pain and your back pain. Oh, that pain with intercourse that you're having? Nope, that's your pelvic floor too. We'll treat all of it. And they're just like, what? I thought I was coming in to do Kegels. Like, what are you talking about? And so that's a part of that, like, gratification and just sort of that reward that we get, where we're just like, no, we're going to change your life. Like, this is it. Your pelvic floor affects so many facets of your life but the problem is they've been so normalized, constipation, leaking, pain that doesn't resolve, some discomfort with intercourse. I'm just dry, I'm older.
Right.
All of that has been so normalized that we don't realize that you can get a solution. It just hasn't been, there's no solution kind of in the doctor's offices.
So looking at the anatomy, and so I'm looking at, like, if I look at the spine, which of course what we're interested in is the spinal health and the health of the femoral neck and the hip, the pelvic region, that whole, because of the bone density.
Yeah.
So tell me how, because this looks pretty critical for bone health. Tell me how that
so
interplays.
I mean, one, I think just the movement of the pelvic floor, getting that lymphatic and blood flow and circulation is huge. We need good blood flow and circulation to our tissue for good bone health, and for, just the structural piece too of the pelvic floor. It helps support the bony structures. And so if you have that, poor bone health, or you have even like people with like hypermobility, they struggle more with the pelvic floor issues, because it works so dynamically with the rest of the body. So, I'm sure there's a cascade of things that happen after bone density starts to not erode, but decline.
Decline.
And so as that bone density starts to affect mobility, strength, your ability to move your body, to do exercises, that then will start to directly affect the pelvic floor, because the pelvic floor is relying on that movement, and it helps with some of that movement.
So, and it's probably too a catch-22, because as people start to have pelvic floor issues, they start to slow down their activity.
Yes.
Because they're leaking, or they're afraid they're going to leak if they do any type of impact or any kind of really strenuous exercise.
Yeah, I think that is a great kind of, that catch-22 is that when people are having pelvic floor issues, the first thing that they want to stop doing is anything with impact.
Yeah.
But that's really great for our bone density.
Right.
So it's like, it's so much more than just like leaking, it's such a trickle effect. And from the bone density standpoint, from just like movement, exercise, all of the health benefits that come with moving and exercise, social isolation, people stop going out, they stop socializing.
Right.
It really just like affects so many different areas of our life, that not just affects like your bladder or your bowel function, but your relationships and your overall health. And it just is, it feels like a spiral, and it's scary because it's been so normalized that the bigger reach of it isn't kind of like, we're not looking the bigger picture.
Well, and with us, within the bone density sphere of things, losing your mobility is one of the reasons why people end up in nursing homes. Yeah. But incontinence or not being able to control their bladder is another big reason why people end up. And so it seems that it's a real marriage, here to
Yeah.
being able to condition both the bone and the pelvic floor through the different therapies. Plus, I'm also thinking like just the way the pelvis sits is that, and we're concerned about the femoral neck, and building bone density in the femoral neck is difficult.
Yeah.
You have to have impact. You have to have a lot of weight on that. But it can also be affected by the way a person stands, which the pelvic floor can control
Yeah.
a lot of that.
Yeah, I mean, the pelvic floor is a structural stabilizer. So for the hips, for the pelvis altogether,
Yeah.
but it is one of its bigger roles. It's like the S's, the sphincter, the sub pump for the lymphatic system. The structural piece is a big piece of what the pelvic floor is meant to do. It attaches out to the hips, attaches to the pubic bone, and then attaches to the back. And so we do see it affect people's posture, but more so that because there's no like perfect posture, we just need to be able to move through them all freely. We need to move. We need to be able to move.
Yeah.
And so when the pelvic floor starts getting restricted or tight, and those muscles start kind of like pulling on the bony structures that they're attached to, people get stuck in certain postures, and that's really where we start to see that the negative trickle down effect, because we don't want them to be stuck and not be able to move through pelvic tilts and move through different postures because of that restricted tissue.
I see. Oh, wow.
Yeah.
So tell me what it's like for someone to come to you, because when I went to your clinic, when Bill and I went over to do a talk,
Yeah.
And you gave us a tour of their clinic, it was nothing like a doctor's office.
Yes, thankfully.
Not
Yeah.
at all. I mean, it was just a wonderful, peaceful surrounding, and just you've made it so comfortable for people. So
that's good.
what if somebody comes to you, what's a first visit like?
Yeah. So it's funny because I just posted today, because it was cold outside. I just put like a reminder for everybody that you will not have to undress and lay on a cold, crinkly, loud sheet of paper that sticks to your butt. We have soft sheets and we have bed warmers, because that matters. That really does matter. This is already uncomfortable. It's already stressful. People are already feeling, nervous about talking about these issues that they're having. They don't know what to expect. And so it's like, and then for it to be a cold atmosphere where you feel like you're just a number, it's just like, compound. So, even within therapy, when I was at some of these other facilities, more of that kind of like ortho, there's high schoolers in there, there's athletes, there's, the knee replacements. We got these people on a bike and that person on a exercise machine. Everything's hopping, everything's busy, everything's, loud. There's hip hop music playing. It's like, and then I had a patient in a room crying because she has, burning vaginal pain for 20 years and can't have intercourse and, is pain with bowel movements and hemorrhoids, and it's like Beyonce's playing in the background and everyone's laughing out there, and I just was like, this is not the vibe.
Right.
Like literally and
Right.
figuratively, like this is not the vibe. So it was very intentionally, created that way. But it starts by, calling our clinic and talking to our admin, who,
Kim.
Kim is
Just love her.
unbelievable.
She's
She was
very
the first
unbelievable.
person that I ever hired. She came on at a time where I had no organization. I had no idea what I was doing. I was just a really passionate young mom who was like, I want to build this thing and this is what I do. And she had the perfect personality. She had no idea what I did. She didn't even know that I was an occupational therapist, not a physical therapist, for the first 6 months. I had to keep being like, that's not my profession, actually. But she was just like, you're so passionate about this. And I believe what you're doing is so crazy. I am all in. So you talk to Kim, who has been around for a long time, and she will make you feel so comfortable, so at ease, and she understands what you're going through. She's heard it all. She has heard it all. So, we work with men and women. We work with anything related to the pelvis. And so it is not TMI. You don't have to feel scared to talk to her. She understands, she can help. And she knows a lot about the pelvic floor and pelvic floor therapy and what we do. Then if you come into the clinic, you don't have to sit and do paperwork. It's all online. Everything is pretty easy and efficient. But when you're coming in for the initial evaluation, we want you to feel like comfortable, at ease, so that way it doesn't feel like a doctor's office, that you feel we are all invested in you getting better from the moment you call. And we ask a lot of questions the first session. We want to get a good idea of like your past medical history, how long you've been dealing with this, what is really bothering you the most, what are the biggest pain points. We want you to understand that you're not a hot mess. That like everyone's always like, oh, I got, I'm such a hot mess, I got this, I got that. But we're like, that's totally normal. That is absolutely, you're at the right place. The more complex, the better for us. We talk a lot about your bowel function, your bladder function, how often you're going, what your bowel movements and, urination is like. Is it easy? Is it difficult? Do you feel like you empty completely? We talk a lot about hormones. We talk about your menstrual cycle. We talk about your vulvovaginal tissue. We talk about estrogen. There's a lot of different things that we're going to be talking about to really get that full picture. And usually even just after the questions, we have a pretty laser focused idea of what's going on. We've all been doing this long enough where we start to see red flags, when you're talking about something in your bladder, and then you're also talking about these certain signs with your bowels. We start to already kind of know what's going on or what we need to start with, at least kind of what the root cause might be, or at least what all is contributing. Sometimes we get in a, physical assessment the first day. Sometimes not. It's a full hour session, but, we really want to make sure that we are being really comprehensive and giving you enough time to be heard and listened to, not just a 3 minutes and then I get my 3 minutes and then you're out. So we talk, a decent amount that first session, sometimes not as much, sometimes more, sometimes most of the session is talking and really making sense of what's going on with you and helping you make sense of it yourself. Sometimes it's not as much talking. We get more physical assessment, and it just kind of depends. But usually the goal at the end is we go through this paper with you that spells it out so that way we don't process everything that is said in that session. Nobody does. It's like you're only going to really retain 30% usually of like what I would be talking to you about in that session. So we write it down. We talk about what are your short-term goals, what are your overall big picture goals, what's going on with the pelvic floor, what's going on with the orthopedic system, what's going on with the nervous system, kind of like what are the different components that we're either already finding, going to be looking at, or kind of what we think is going on, so that we have that. What's going to be happening next session, and then kind of our approach that we take, like what's it going to look like? Like what's your kind of plan of care starting to look like? So that way you can take that home and review it and be like, what the heck was going on here? I thought I was just going to go do Kegels, and now they're talking about this and my bowels. And so it really helps like make sure that's a priority for us, is that at the end of the session, you don't have to remember everything. You're not going to be handed a big packet of exercises and magically supposed to be able to find 30 minutes to do it at the end of the day. We want you to know that you're at the right place, that none of this is new or scary to us. It definitely probably is to you, but like we understand you're at the right place. We absolutely are going to be able to help you and to have hope. To not be so scared, to not have so much fear of your symptoms and fear of the unknown, but to like, we want to make it more known so it's not as scary, and that you know that you can get better.
Oh, that in so many ways mirrors a lot what we do at OsteoStrong. When somebody comes into us, it's that really reassuring somebody that we can help you.
Yeah.
That fear of, especially when you're talking about very sensitive issues like the bladder and the vagina and all of that. That's very sensitive issues, but it sounds like you're able to really reassure someone that, hey, we can help you. This is not out of our, and you don't have to suffer.
Yeah. And I feel like when you came and did that talk, I'm 36. But I have so much fear about osteoporosis and osteopenia and all of these things. And just like knowing that you guys know.
Right.
Gave me so much comfort,
Yes,
and
exactly.
I think that that's what's missing in our medical system, is that like, I don't have to know it all. I don't need to feel anxious that I'm responsible for my medical outcomes, that I have to Google it because these doctors or these medical professionals aren't listening. So it's up to me. That creates so much medical anxiety. And
Yeah, when we're Dr. Google.
Yeah, I know. It's, I mean, I've done it myself. You know, I had to do it with my son. We had some issues with him that I was like, well, these doctors aren't helping me, so I'm going to have to do it myself. And when we finally found somebody who knew what was going on, who took the time to listen to us. Now, we had to go out on network because he was just a cash pay doctor. But I knew instantly that I would get what I needed by going to a cash pay doctor and out a network doctor, because he'd be able to take the time with me and he cared about it and he was specialized in it. And so the relief that I had, I cried because I was just like, this is for somebody to just listen, you know? So that really reshaped how I mean, that was already our goal, but going back to the clinic after all that, I was like, guys, what we do is so important.
Yes.
You know, to be able to tell these people you're at the right place. We absolutely understand. We've seen this before. We know what to do. We are going to help you. It is so incredibly invaluable that it is, there's so much medical anxiety and so much confusion, too much information out there.
Right.
In your space as well.
Exactly.
You know, I mean, I've dove down that. I told you my mom got diagnosed with osteopenia. And I mean, I was just like spiraling. I'm looking at all these different things. I was just like, I don't even know. I'm going to have to learn a whole new profession in order to help my mom. You know, it's stressful.
It's very
stressful. Like you're always on guard. Are the doctors making the wrong decision? Do they actually know? It's so anxiety provoking. So, you know, being able to provide those individualized services and be like, yeah, we understand it. Yeah, you're at the right place is huge.
Well, and I don't know, is it Brooke? Brooke's the other. I've met Tiffany, obviously. Yeah. And Tiffany is incredible. So you have such great staff that are compassionate like that and that understand and want to help. Yeah. I mean, I know Tiffany did, you know, she came to you right away.
I was like trying like swooning her, trying to date her. I was like, I'm going to take you out to dinner. Could you please leave and come here? Because she was one of those unicorns where it was like, she was in that mill setting where it's like they're pumping her full of patients. They're pumping her with the assistants and the aides, you know, taking her patients and doing the treatments. And that's a really, really, really hard way to get patients better, especially in pelvic health. But yet time and time again, I'd hear people talking about this Tiffany therapist, how she's really great, how she got me better, how, you know, she was able to do this or that. And I was like, I got to find this girl. And I got to get her out of that setting because it's not only bad or hard on a patient. It's that setting. It's hard for therapists to see that many patients in a day.
Sure.
I mean,
the burnout of that.
The burnout, yeah. I mean, it just, and for her to keep her passion and her drive and push herself in that setting and not just give up and do the bare minimum, I was like, I gotta get you, girl. So I was like whining and dining her. I was like, let's go out on another date. So she's been with me a couple of years now. Phenomenal. And then Brooke is our newest therapist. I mean, well, it's been a year too, but just impeccable. I mean, I couldn't be more proud of my team and more just grateful for them. I literally thank them every day. I hugged them today just because I was like, you guys are just so good.
Well, they reflect your passion, which I think is really key.
We hold a high standard for sure. You're not, I'm not afraid to, you know, let therapists go who are not hitting those standards. You know, you have to be providing a world-class level of pelvic health care. You have to have compassion. You have to be extremely personable for these people. You can't be having a bad day and just be like, yeah, I'm just not feeling it today, but you know what, here's some exercises you can do. I'm just not feeling my back. It's like, no. These people, we need to change their lives. And so I really do hold a high standard, and they are exceeding my standard far and beyond. I just hug them every day. I'm just I'm so grateful for you. Thank you so much. Thank you for what you do for our patients, but just the peace that I have as a
and so that people,
owner.
when they leave your facility, they are happier than when they came in. That's the goal.
I mean, I think we might be the highest rated pelvic health clinic in Ohio.
Wow.
Now. Or we're getting really, really close.
Yeah.
And definitely in Western PA, Pennsylvania's pretty big. So
yeah,
that might be a bit harder, but I think we're the highest rate in Ohio now. And that is 1000% a testament to the team.
Sure.
I mean, like, it's not easy. It's hard to get people to write a review.
Right.
But it's also harder to get people to publicly talk about like their bladder or their constipation, or like some intimate detail. No, they don't have to write, but they do. We're always just like, a 5-star or whatever would be anything you feel comfortable sharing. And then they get on there and they're talking about, their intercourse and their, pelvic pain and their burning vagina and, all these things. And we're just like, these people are so passionate that they are so thankful and grateful that they got better, that they're willing to not just leave a review, but like talk about it publicly. Like, that is a testament
and help
to
other
the team.
people, because that really helps other people. So what is your, who has pelvic problems, I guess?
Yeah. Oh gosh, who doesn't? So, I mean, you're born with a pelvic floor. So we don't, I wouldn't say we're like fully prepared to treat pediatrics. We do take on some pediatric cases because there's no one around that we can refer them to for pelvic health specifically. We just mostly don't have like the equipment and the atmosphere that makes it easy to work with pediatrics. But Tiffany, she does work with pediatric patients. She does do some like home visits, and she kind of partners with some of the pediatric clinics in the area, and we'll see some patients at their facilities. So you're born with a pelvic floor. Men and women have pelvic floors, and dysfunction can arrive at any time. Anytime in your life, issues can start to happen with your pelvic floor. It's not just childbirth. It's not just if you've had a baby. Kids can have issues in potty training and chronic UTIs and stool withholding and bedwetting. And then that usually, at least historically, hasn't been treated properly. So then they turn into teenagers who continue to have pelvic health issues. Now it is constipation and bloating, and they can't insert a tampon, or they have hemorrhoids, or, back pain or hip pain. And then you get into adulthood and it just evolves into more normalized issues. And then maybe their hormonal changes are happening. They go through childbirth. That usually brings a lot of issues to the forefront. It exacerbates a lot of issues that may already be starting, or it creates issues, creates pelvic floor dysfunction. And it can evolve from there, but it can also happen after, an injury. It can happen after a really bad UTI. It can happen after surgery. It can happen after, just really at any time. And it's not just men or women. We see everybody.
What if it's like you've had a long illness? Can that trigger some issues with that?
Yeah. I mean, it can cause, if you have like excessive coughing, or if you've been constipated, anything that requires you to increase your intra-abdominal pressure, like throwing up a lot, or having like a persistent cough, or it creates a bunch of constipation, so then you're having to strain a lot. That in and itself can start the kind of like trickle of issues with the pelvic floor muscles that then turns into back pain or hip pain, or, pain with intercourse. And it just starts to kind of like snowball a little bit. It's rarely just in isolation. It's rarely just kind of like leaking. I mean, if somebody just comes in, they're like, yeah, I just like leak sometimes. We're like, I don't believe you that's it. There has to be more. I mean, it just, if that is the case, which I want to be the case, I want people to be like, oh my gosh, I sneezed when I laughed, or I started to, or I leaked when I laughed, and I was leaking, that one time when I ran, I better go to pelvic floor therapy. If we could get to that point, so many chronic issues that plague men and women especially could be prevented. We just need people to start realizing that that's not normal. That's a sign. So bladder leakage is not a diagnosis. It's just a symptom of a bigger diagnosis. So if we get people to start thinking that way, the same way that they're like, oh, my, back hurts, I need to go, I have a little twinge in my back. It's always like right away, everyone's like, I need to go see a chiropractor. I need to go see a chiropractor. I, like breathe wrong. I need to go see a chiropractor.
Right.
It's like, which is fine. I'm not saying that that's a bad thing, but we need to start realizing what is not normal and seeking care quicker, and it will prevent a lot of issues.
So, someone, if they, so you're talking about, it's not just Kegels. So what is involved in pelvic floor rehab?
Yeah. So, I can't remember if I've ever really given anybody Kegels as a like something they need to be doing. It is just the pelvic floor doesn't usually need strengthened. It usually needs, we need to find the pelvic floor, be able to know where it's at within your body. And usually people need to be able to relax it, to lengthen that tissue and have better coordination with the musculature. We are sometimes doing transvaginal or transrectal pelvic floor assessment. So that's just a one gloved finger assessment where I'm inserting it vaginally or rectally for our male patients. And I'm then assessing the pelvic floor. I don't think this one comes off. No. Assessing the pelvic, the bowl of the pelvis, the muscles.
Yeah.
So what's going on? Is there tension? Are there kind of
So you
spots?
can tell that. You can
Oh,
tell
right away. Yeah. I mean,
right
I can
away.
usually tell with the questions.
Okay.
You know, I'm able to be like, it sounds like you have a lot of tension. It sounds like it's a coordination thing. It could be, you know, a stress nervous system factor. Pretty quickly, I can kind of paint that picture.
Yeah.
But if I think that there is tension, I want to know what's going on. So is it more towards the front of the pelvic floor, more towards like the bladder and the pubic bone? Is it more towards the hips and the muscles that help rotate the hips? Is it back towards the tailbone and the sacrum? You know, is the left different than the right? Is there kind of nerve impingement going on with some of the nerves that run through the pelvic floor? So we want to get that idea of like what's going on with the musculature and start to treat that. It's not what people think as far as like therapy, you know, in that mill setting, similar to a doctor. If they have a short period of time with you or you're kind of getting ushered off to an assistant, they don't have enough time to do really comprehensive therapy. So they're usually giving you exercise. It's like a packet of exercises. Take these home and do these at home.
Yeah.
And we don't do that because usually a bunch of exercises isn't what you need. And it's usually unrealistic. People aren't going to be able to just like fit this in magically, all these exercises. And sometimes it causes more stress and more pressure than it does any benefit. And stress and anxiety can contribute to the pelvic floor getting really tight and restricted. And so sometimes the exercises, if they're causing you stress, they're outweighing any benefit that they would even have.
It's making it worse.
It's making it worse. So we do get to that orthopedic assessment too. We're looking at the spine, we're looking at the hips. Sometimes we're looking at the foot, we're looking at the rib cage, your core, your diaphragm. We're looking at pretty much the whole body. We're asking you about your stress, your anxiety, seeing if you have what's called central sensitization, which is basically when the brain stays too on high alert and it sensitizes your tissue. So you're feeling a lot more in your body. Normal sensations, like you're feeling your bladder filling and your brain's misinterpreting that as a bad thing. And so you'll get bladder pain or bladder urgency when it's really a normal sensation that's just getting misinterpreted from a sensitized kind of system. So we get into that, you know, we'll get into psychology, we get into mental health, we get into kind of, you know, that aspect because you're a whole person, you're not just your body. So we will give you exercises sometimes stretches. Sometimes we're doing manual work to your abdomen. We're physically releasing musculature. We're mobilizing your uterus or your bladder, opening up space, releasing restrictions, scar tissue, things like that to help relieve some of your pain or your symptoms. So it's really, it can be a lot. We do dry needling. I mean, just a little bit of everything.
And you mentioned the diaphragm. So breathing plays a big role.
Yeah. Breathing plays a huge role. That when you inhale and your diaphragm flattens basically, and then your lungs fill with air. It's like a vac system. So your diaphragm drops. It should expand 360 degrees. Your whole rib cage should expand on inhale. Your back should expand a little bit. Your abdomen, your sides. This nice sort of umbrella effect. Yeah. So your diaphragm has to be able to drop to do that. You have to have, you know, no restrictions and nice loose tissue and fascia within your rib cage and your spine to get this nice beautiful inhale and then an exhale and then the diaphragm comes back up. So when the diaphragm hopefully is moving really dynamically like that, when you inhale, the pelvic floor it's like a piston so that you inhale and the pelvic floor should expand and drop a little bit too and stretch.
And relax.
Okay. And then you exhale and the pelvic floor comes back up gently. And so all throughout the day,
like an elevator.
All throughout the day, you should be getting a nice like ebb and flow of your diaphragm and your pelvic floor. But we are not optimal human beings, you know, with our lifestyles and stuff. So breathing dysfunction can start. You can get maybe after childbirth, your rib cage changes, your posture changes. So now your breathing has to adapt. You're not getting a good diaphragmatic breath. You have restrictions all throughout your abdomen or your rib cage. And so that pelvic floor is like this all day long. And your breathing is short and shallow all day long. And so everything's just tight, pulled up, restricted. And so we're getting this like nice ebb and flow. Over time, you'll start to have symptoms from that. And so that's where we kind of say, like, we can't just Kegel the pelvic floor. We can't just release tension in the pelvic floor. We have to look at why is the pelvic floor like that. And so sometimes it's up into the rib cage.
I think so many women can just relate to exactly what you just described.
I know.
That
so many, everyone's so
right,
tense.
so tense.
Everyone's so tense, yeah.
Yeah, so tense. So would that be like one of your, if you were just to give like 2 or 3 pieces of advice right now to somebody, what would you say?
Biggest thing. So if I had to take like my heavy hitters, I would say get a squatty potty. You need to be in a squatted position when you poop. Everybody, children, men, women, everyone, we are not designed to be having bowel movements on a toilet, especially the higher toilets. So get a squatty potty and relax instead of straining. The second would be to check in throughout the day into kind of this part of your body. Are you holding your abs in really, really tight, sucking in your abdomen, clenching maybe your abs, holding your rib cage tight? Yeah. And if you are, let it go. Relax your belly. Let it get squishy
let the belly
and big.
Let
it go. And then because your pelvic floor will follow, whether you can know where your pelvic floor is or not. If you're relaxing your abdomen, you're letting your abdomen breathe, you're getting a nice deep diaphragmatic breath in, your pelvic floor will move. And so you're going to get that, for free, no equipment needed, nothing, you don't have to do anything. You just have to relax and get more diaphragmatic and rib cage movement, and your pelvic floor will also benefit. So just relaxing everything. And if you can, try and find kind of the muscles around the vaginal opening, around the rectum, and see if you can let them go too, And if they're like this, or you feel like you can't move them at all, then they might be restricted and tight. And so trying to let them go, just let everything go, relax, breathe, quit sucking it in, let your belly hang, quit squeezing your butt cheeks. Everything just needs to relax. So I would say that's a big one. And then if I had like another heavy hitter, oh my goodness, there's so many different ones.
What about with peeing?
Yeah, so quit just in case peeing. That's a big one. So that like, I'm just going to pee when I get here. I better just in case pee again. Because you can be creating bladder urgency and bladder frequency. So like you don't have a small bladder. Like people, it's like always, it's not a quirky personality trait to be that friend with a small bladder. It means you probably have pelvic floor dysfunction and you need bladder retraining. And you can inadvertently start doing that actually in potty training, teaching your bladder to give you the signal to go pee before it's actually full. And so it's not that people's bladders are small. It just is that their signals have gotten condensed. And so they're getting that, you got to go right now signal way too early. And so some of the things that can contribute to that is that just in case peeing. Pee every 2 to 4 hours. Like there's bathrooms everywhere. You don't need to pee when you get there and right before you leave and just in case again. And, same with your kids too. Like let their bladders fill. Let them fill for 2 to 4 hours. It's okay. Now, if there's pain with your bladder filling for 2 to 4 hours, then you definitely need to be coming in because that's a sign that there's something going on we need to check out.
Wow. That's really good advice.
Yes. Yeah. And it's like sometimes I get so deep into the complexity in the realm that it's like I forget the basic things that people don't, know. It's like I forget sometimes. Another one I would say too is that don't overlook your muscles with constipation. Everybody wants to drink more water and eat more fiber, but the hard truth is your stool consistency could be absolutely impeccable, perfect when it gets to the end of the rectum. And if you can't get it out through the pelvic floor because of tension or coordination issues, that stool will stay in the rectum and it will get hard because it absorbs water back into the colon. So, and then you have a hard bowel movement or your stool is hard and you're like, I got to drink more water. I got to take my fiber. And your stool's like, listen, I was perfect. I was perfect. That was a you problem, not a me problem. Like I looked great. You just couldn't get me out. And so that I think is like blows my mind that for the epidemic that we have of constipation and straining with bowel movements and hemorrhoids, that we aren't talking about the pelvic floor, which is, it's called outlet dysfunction, where you can't get the pelvic floor to do this nice relaxed opening to allow the stool to come down nicely. And that's what's contributing to the constipation or like excessive wiping or the hard stool.
And so, but a squatty potty would
That
just
that
help.
helps a little bit. Yeah. I mean, that's just a bare minimum. Everyone needs to have a squatty potty.
Right.
Yes, I don't care. But it could be stool, it could be boxes, it could be whatever you have near you. Just get your feet up on something so that way your knees are higher than your hips and you're in a squatted position. Because without it, the anal rectal angle where your colon kind of comes and meets the pelvic floor, it stays kind of kinked like this. When you get into a squatted position, so it has to kind of overcome this harsh angle to get out.
Right.
When you get into a squatted position, that angle straightens out.
It's like
the pelvic floor muscle lengthens, and now it's way easier to get that stool out. So, it's. I don't. Everybody I meet, I'm like, you got a squatty potty? You got one? Even my family, everyone's like, I've got get everybody. Yep, everyone gets a squatty potty, and they're always, even in my like family members that are like, oh no, I poop every day. I have great poops, whatever. They're like that. It changed my life. I thought I had good poops, but man, that's squatty potty. So it's just like so easy, like that's just everyone needs to have one. We're just not designed for that position.
So, I guess as we kind of finish up, I don't want to keep you too long, but as we finish up, what are some of the myths around pelvic health that you feel like you want to dispel?
Yeah. I feel like we've touched on a couple of the big ones, the Kegels, how like they're going to solve everything. They don't solve anything. That it's just for women. We treat a lot of male patients. I would say myself and Tiffany both treat men, and her caseload might be 30% male patients. We have a lot of male patients who come to us. So it's not just women. We treat all ages, really. We treat women who have never had children. We treat, young women who can't insert tampons or have terrible menstrual cycles, of endometriosis, and they've never had children. So you don't have to have had babies to need pelvic floor therapy. That it's not just leaking. That is another big one, that it's so much more than that. Leaking is just one of the symptoms that we treat. Another myth, I would say, is that all physical and occupational therapists can treat pelvic floor therapy. That is not true at all. We don't get this training in school, so it's all post, graduate training that we have to pursue. And the medical system is starting to realize that pelvic floor therapy is starting to become more popular, more of a buzzword. And so there's no real standardization for us to call ourselves pelvic floor therapists. Now, obviously, that's all we do at the clinic. All we treat is pelvic health. So we are hyper specialized in that because you really need to be. I can't be good at treating your elbow and your pelvic floor. So what a lot of these medical systems now are, they're saying, hey, this could be a whole new, clientele that we're pulling in for patients. So, hey, you PT over there, will you take this online course about like Kegels and stuff, and then you can be our pelvic floor specialist? And they're like, yeah, I guess, like, I don't want to talk about this stuff with somebody. Right. And they're not equipped literally from a skill set. They don't have the right kind of environment and facility. And it's unfortunate. And that myth of like, well, therapy treats this. My PT, they say they have a pelvic floor specialist. Do your due diligence and research, because we see so many people who have gone to pelvic floor therapy and it's so far removed from what pelvic floor therapy actually is. Oh, and what that does, and these are the people who are brave enough to try again. Right. So there's so many people who think pelvic floor therapy failed them, that they're just so bad off that the pelvic floor therapy doesn't even work for them. And now they're getting surgery, or now they're getting put on a medication. And so it does nobody good. And the therapist, if you don't know what you're doing, that's overwhelming and stressful too. But, I think the myth is that like PTs and OTs are all just, musculoskeletal experts, and that is not the truth. And vice versa. My dad just had a knee replacement. I was like, I am so sorry, Dad. I know nothing. I can help you none, 0%. I don't know anything about the knee, and I don't know anything about the shoulder, and don't ask me about your carpal tunnel. I don't know.
Right.
Because I can't be good at all things. I can't be a jack of all trade, master of none. We want to be a master of one. So that's, I think, a common myth too, and a dangerous myth.
Right, right. Well, I think that's just fascinating what you're doing and the knowledge that you have brought to this area and the people that you've helped. Like, what percentage of people do you think walking around today have pelvic floor issues?
A really, really, really high percentage. I mean, we aren't even scratching the surface of,
Right.
of people who have pelvic floor issues that are getting to us. I mean, we're probably getting like 1% of the people who actually need us. I mean, it's so prevalent. If you just look at chronic back pain, pelvic floor dysfunction, chronic hip pain, pelvic floor, you need to be coming in. Hemorrhoids, you need to be coming in. You know, it's like just even if we just did that as a blanket, those people who meet one of those criteria should be coming in. It's astronomical the amount of people who could be doing better and who could get on the right path quicker, save time, save energy, save money, save copays, save frustrating doctor's visits.
We don't need their life back.
Yeah, and we don't need scripts, you know, because we're physical and occupational therapists in the state of Ohio. Like, you can just walk in. And I mean, we don't take walk-ins. Like, you would need to get scheduled on our therapist schedule, but we don't need your doctor's scripts. We don't need your doctor to refer us to you. You can just come straight to us. We do a comprehensive treatment and our own evaluation to where it's like you can bypass all of them. And if we feel like there's something going on that we need to consult your doctor, absolutely, we would make sure you get those, you know, testing and medical stuff done. But we don't need a script. So there's very little barrier.
So tell us how to find you.
Yeah, so we are in Poland. So we're right in the Poland Plaza, kind of across from the clock tower. You can find us on our website, vitalpelvichealth.com. Instagram, we put out a lot of, you know, good information, free information to try and educate the masses on Instagram at Vital Pelvic Health. And give us a call. You know, we offer free, you know, chats with a therapist. If you have a question that you feel like you need very specific answers for your symptoms, our admin is always happy to be like, you know what, why don't you just chat with a therapist directly for, you know, 15 minutes, see what they have to say. So you can talk to us, you can talk to the admin. We are obviously love talking about pelvic floor issues. So it's like, we are always ready to chat. Find me out at, you know, a coffee shop somewhere or, you know, out at a restaurant. You better believe I will be talking about the pelvic floor. My poor husband can't go anywhere. We can't go to any party, any weddings without me. It's like a timer. How long till Paige starts talking about poop? It's very short, I can tell you that.
Oh, gee. Well, this is so great to talk with you and to see you again and talk with you. And
you too.
Best wishes to you as you
Thank you.
help all of these people around the valley and
hopefully
and around the country.
Yeah. I just did a consultation with somebody from North Carolina today. You know, good quality pelvic health care isn't universal, even within the United States, definitely not globally. So glad to be able to work with people even remotely.
Well, that's great.
Yeah.
Well, thanks, Paige.
Yeah,
great talking to you.
Good talking to you too.
Thank you for listening to Primal Bones, where we break down the stories, struggles, and steps that shape us. Remember, your best life is not behind you, it's before you. Keep moving forward. God bless.